Hello, CVB students. This is Dr. Kamel, and this is a new question of the NPT style question. Let's see, today's question is what subject or what is the content of today's question. So the question for today is saying a physical therapist reviews the results of a patient's pulmonary function test prior to examining a patient. The therapist notes that the patient's total lung capacity is significantly increased when compared to established norms. Which of the following medical conditions would most likely produce this type of result? We have two main categories for pulmonary diseases we are dealing with: restrictive lung diseases or obstructive lung diseases. And beside our physical examination, which we are doing for those patients, sometimes we need to look at the pulmonary function test results in order to know if the lung capacities and lung volumes are within normal limits or outside of these normal limits. There are differences between obstructive and restrictive lung diseases. So we will have increase in some volumes, decrease in some volumes, increase in some capacities, reduction in some capacities according to the type of disease we have. So here we have four options: chronic bronchitis, emphysema, spinal cord injury, and pulmonary fibrosis. Okay, if I look at these four options, you have a patient with increased total lung capacity. So I would expect that there is hyperinflation of the lung. Okay, and if I am looking at these options, I would expect emphysema could be one of the top list for me in these answers, because spinal cord injury is a neuromuscular disorder usually associated with reduction in lung capacity, or you can say there are some sort of restriction. Pulmonary fibrosis is the same inflammatory condition with destruction of lung tissue, which will lead to restriction. Chronic bronchitis is a case of chronic inflammation with production of tons of mucus secretion over a long time. So let's explain each option and see what is the correct answer. The correct answer is emphysema. But why? Why this is the correct answer? Why in emphysema we see increase in total lung capacities? Okay, so emphysema is a chronic obstructive pulmonary disease, or COPD, characterized by abnormal and permanent and abnormal enlargement of air spaces where distal to the terminal bronchioles, accompanied by destructive changes in their walls. Changes in lung tissue resulting from these anatomic changes include loss of elastic recoil of the lung, and collapse of airways during exhalation, and also airway or airflow obstruction. So the problem is you have a difficulty in getting air out of the lung. Okay, why? Because you have lost the elastic recoil of the lung. The lung is hyperinflated, and this is permanent inflation. As a result of these pathological changes, which we see within the lung tissue, in emphysema, the lungs become hyperinflated, okay, due to, again, loss of elastic recoil, obstruction to airflow, and this will result in increase in total lung capacity, residual volume, and functional residual capacity. Okay. Let's look at the other options, or the incorrect options. Chronic bronchitis. In chronic bronchitis, there is chronic inflammation with mucus production for about 3 months for 2 successive years. So this is a definition of chronic bronchitis. There will be hypertrophy of the submucosal glands, where in the large and small bronchi and trachea, okay, with hypersecretion of mucus, and there will be productive cough as well. Pulmonary function test will mainly show, decrease in forced expiratory volume in 1 second. To be less than 65%, should be more than 70%. So here it is less than 65% of the predicted value. Total lung capacity is not increased in true chronic bronchitis. Option number 3, spinal cord injury. Spinal cord injury is a neuromuscular cause of restrictive lung dysfunction, characterized by, loss of, some of the inflation of the lung, and there will be decrease in total lung capacity, vital capacity, and inspiratory capacity. So here we will have decrease, not increase. In pulmonary fibrosis, as an inflammatory process which is affecting mainly the alveoli, there will be distortion of the architecture of the lung. Okay, these changes will affect lung compliance, or the ability to inflate the lung, and decrease in lung volumes, including total lung capacity, vital capacity, functional residual capacity, and residual volume. So this is the end of today's question, and I hope to see you soon in a new question. Good luck.